Good morning and welcome to the COVID-19 vaccine Q&A for after-school professionals. I'm Kelly Sturgis, the Executive Director of the New York State Network for Youth Success. For those who do not know, the New York State Network for Youth Success is a statewide nonprofit dedicated to increasing both capacity and access to high-quality expanded learning opportunities, such as after-school, summer programs, community schools, and any other expanded learning program in New York State. We are the New York State affiliate for the National Afterschool Association. We are one of 50 state after-school networks focused on policy work aligned with the Afterschool Alliance. We are the backbone agency for the New York State Community Schools Network, and we are the New York State lead for the National Girls Collaborative STEAM Project. We support programs in several ways. We do all of the policy and advocacy work in New York at both the state and federal levels. We do this through securing funding for state and federally funded programs, either to allow for more students or increase the per student rate, so programs can offer higher quality programs. We work with the State Education Department and OCFS as the intermediary between programs. Sometimes this is around regulations or RFP language. We work with partners all around the country to bring best practices and research to programs to help support quality and other initiatives. We also have 15 regional networks around the state to support programs locally. We created the School Age Care Credential for New York State, program accreditation, the quality self-assessment tool, and we have the only annual conference focused solely on after-school, summer, and expanded learning programs, which will be held on April 23rd and 24th this year, and will offer training in the ACEs topic area, among others. Racial equity and diversity, equity, inclusion is something very important to the network. To support the field, we engage in staff development, share resources around a wide variety of issues related to diversity and equity, and disseminate current relevant research to enable programs to create safe and caring environments. We also work with state and local organizations to help frame policy and engage in advocacy to ensure that providers are intentionally supporting diversity, equity, and inclusion. We have 2 credentialed trainers and credentialed coaches on staff to bring high quality training and supports to programs. The Network for Youth Success is a membership organization. Membership comes with many benefits, including biweekly e-newsletters and monthly grant newsletters. Lastly, to ensure youth have access to healthy food after school, the network helps connect programs to the Child and Adult Care Food Program, which is a federal entitlement program that provides reimbursement for healthy after-school suppers and snacks. Now, with that quick overview, it is my pleasure to get this Q&A started. As we know, the COVID-19 vaccine is now available for childcare and school-age childcare providers in New York State. Despite eligibility, we know that many of our friends and colleagues are hesitant to receive the vaccine. Today, we have medical and public health experts ready to answer your questions to help you make an informed decision. Please join me in welcoming our panelists. You can find their full biographies at the link in the chat box, and we will share them as a file as well. Dr. Lynne Holden is the co-founder and president of Mentoring in Medicine. Dr. Holden is a national thought leader on the persistence of youth of color on the journey to a health career. She serves on several national and local boards, including the CUNY School of Medicine Advisory Board, co-chair of the Executive Advisory Board for the National Academy Foundation DC Public School CTE in Washington, DC, and the Touro College of Osteopathic Medicine Community Advisory Board in Harlem. Dr. Holden also serves as chair of the K-Grad Action Group of the Roundtable on Black Men and Women in STEM of the National Academies of Science, Engineering, and Medicine. She is practicing emergency department physician at the Montefiore Health. Sorry, got muted there. She's also a professor of emergency medicine at the Albert Einstein College of Medicine, the 5th African-American female in the country, and vice chair of diversity, equity, and inclusion. Dr. Clement Nsiah is the director of population health and evaluation at BestSelf Behavioral Health in Buffalo. At BestSelf, Dr. Nsiah oversees the agency's population health initiatives and projects implemented to improve the health outcomes of patients who visit the agency's community-based clubhouses and clinics. In his role, he has hosted several vaccine Q&A sessions for his community. Dr. Nsiah also serves as a member and advisor to the agency's Quality Improvement Department. Dr. Steven Schultz is the Rochester Regional Health Ambulatory Pediatric Medical Director for Monroe and Ontario Counties. Dr. Schultz is a practicing pediatrician for RRH's Finger Lakes Medical Associates in Geneva. In addition to guiding RRH's pediatric COVID response, he is also a member of the Finger Lakes Region Reopening School Safety Task Force, a coordinated effort between medical, education, mental health, and public health experts in the area. He is actively involved in teaching, research, and community advocacy efforts. Dr. Schultz graduated with honors from the University of Illinois College of Medicine in Rockford, completed his pediatric residency at the University of Rochester Medical Center Gosseliano's Children's Hospital at Strong, and previously worked at the Crusader Community Health, a federally qualified health center in Rockford. Thank you to our panelists, and now let's get started on your questions. We will begin this Q&A focused on the questions that you submitted during registration. If you have other questions as we go along, please add them to the chat box. If you would like to remain anonymous, you may send your questions privately to Allie rather than sending them to everyone. The first set of questions you submitted were around vaccine eligibility. We have some eligibility information available on our website, which we will put in the chat now. I'm going to turn to Clement first to answer this set of questions for us, but then if any of our other panelists would like to add anything, please feel free to jump in. Clement, do school-age childcare staff have to work in person to qualify, or can they be working virtually and come in person for administrative tasks?
Well, thank you, Kelly, and to your group and to the panel for putting together this session. It's critically important for us to be able to hold these type of sessions to give people the most accurate and precise information as both the state and the federal level continue to release information. So in regard to your question, in terms of if you're working in person or virtually, if you're qualified to receive the vaccine, at this point, based on the guidelines of New York State, if your program or if your provider and your program is eligible to receive the vaccine, or they do encourage you that whether you're working virtually or in person, you should go ahead and go receive the vaccine. So at this point, if you're part of a provider group that's eligible to receive the vaccine, whether working virtually or in person, they highly recommend that you go in and receive the vaccine.
Great, thank you so much for that. Do you know if non-licensed after-school providers are eligible?
So the guidelines as published by the state do not exactly explicitly use the word non-licensed. The words that they're using right now is licensed, registered, approved, or legally exempt after school or childcare programs. So if you are a program, you fall under the non-licensed category, I think it's best for you to reach out to the state or perhaps use the state's iEligible page or app to answer several questions to identify if you are able, if you're eligible to go in and receive the vaccine.
Wonderful. What about non-staff? So are interns in after-school programs eligible?
Yes, at this point, yes. So every support staff, volunteers are eligible to receive the vaccine as long as your program is eligible to receive it.
Great. Do you know what proof you need to provide to be eligible for the vaccine?
So if you have scheduled an appointment when you're going in to receive the vaccine, it's important for you to bring some form of an identification form. So something that shows that an ID from work, or you can bring a letter from your employer. If you have a pay stub, you can bring that as well too. So those are the type of documents that you can bring with you in order to prove eligibility or to prove that you work with an agency or organization that's eligible to receive the vaccine.
Great. Do you know when and where after-school personnel could be vaccinated?
Well, right now, you're eligible to receive the vaccine. So I will encourage everyone to continue to visit iEligible page by the state. They have several sites across the state that you can schedule to go get vaccinated. I would suggest and encourage that folks do that as soon as possible, because we are learning that we are running out of vaccines and sites are running out of vaccines. So at this point, folks that works within childcare, approved childcare, and after-school programs are eligible to receive the vaccine. So you can go online and schedule an appointment.
Thank you. We also had some questions on whether there are requirements to take the vaccine. Clement, is the vaccine mandatory? Could someone lose their job if they choose not to get vaccinated?
So at this point, federally, there is no law asking people to mandating people to go get the vaccine, but employers do have the right to mandate their staff to go get vaccinated. So it's critically important that if you talk to your employer and make sure that if there's such policy in place, most of the time, some organizations have waivers that folks who are not comfortable with getting the vaccine can sign the vaccine, sign the waiver. There's a way for the employer to be able to get some count and acknowledgement that they provided the information to you and the opportunity to receive the vaccine. So if you work for such an employer organization, please talk to your employer and see if you're being mandated to get the vaccine, and I'm sure they'll be able to give you the correct information.
Wonderful. Our next questions are related to state requirements. I've been in touch with our partners at the Office of Children and Family Services, as well as the Department of Health, to get official responses to these that I will hopefully share. So the first question was, will OCFS mandate all childcare workers and school-age sites of employment to get the vaccine? The response we received is that it's unlikely that OCFS will mandate this. However, OCFS frequently defers to the Department of Health on these types of matters. The other question was, if the vaccine is mandatory, by when will staff have to take the vaccine? So as far as we know, the vaccine will not be mandatory for staff. We will update the field through notifications to our listserv if that changes. You can sign up for our listserv using the link that we'll put in the chat box now. So be sure to select statewide as one of your choices to make sure you get this information. With that, we're going to look more closely at specifics of the vaccine. So Clement, these next questions are also directed for you. These vaccines were developed quickly. How do we know they are safe?
That's a very good question, and people have been asking that question due to how quickly we're able to develop the vaccine and have the vaccine available to the public. So traditionally, a clinical trial falls on different phases, about 3 to 4 different phases, and those phases, so for instance, phase 1 has to finish before phase 2 begins. In this particular case, the phases were completed sequentially, so they did not have to finish phase 1 in order to finish phase 2 or go into phase 3. So that's how we're able to develop the vaccine in such a quick fashion. In terms of the vaccine itself and the technique that was used, is a technique that's not new. It's been in place, it's been in use for some years now, and I'm sure that both Dr. Holden and Dr. Schultz can speak to this as well too. It's been used in some instances of cancer trials and cancer treatment. So the science and the scientists have been working on this technique for a very long time. It just happened that we're able to, at this point in time, to be able to work very quickly through the clinical trials.
Thank you for that. Dr. Schultz or Dr. Holden, if you have anything to add, please feel free to jump in.
Sure. Thank you very much for having me. And, you know, it's very interesting because, as Clement mentioned, this technology has been used, for example, with cancer treatment, with immunotherapy, for example, also with other diseases, MERS and other diseases in the past. So it really was a matter of sort of marrying all of those factors and coming up with this vaccine. So the groundwork for it has been done for many years. It was just now getting the new information, the genotype or what we call the genotype or the footprint, quote unquote, for this new COVID-19, and actually putting that information into the technology that has already been developed.
Thank you. Clement, how many different COVID vaccines are available, and what is different about each?
So right now, there are 2 vaccines approved for emergency use by the FDA. As most people have seen in the news, it's either the Pfizer or the Moderna. Just before we got onto this platform, the FDA released their, the acceptance of the Johnson & Johnson vaccine as well too. Both the Pfizer and the Moderna vaccines use the same technique as Dr. Holden just indicated. So they both use the mRNA technique. The Johnson & Johnson uses a different technique. It uses the adenovirus technique. In terms of the Moderna and the Pfizer that's being administered at this point, as I said, the techniques are the same in terms of the machinery in the way that we are delivering the vaccine into our system is the same. There are a few tweaks here and there in terms of how organizations are able to store the vaccine. I do believe the Pfizer vaccine has to be stored at a -70, and the Moderna at a -16 or so. If I'm mistaken, somebody can correct me. Both Dr. Holden and Dr. Schultz can correct me.
They did just change the Pfizer to be able to store in regular freezers now instead of the super deep freeze. So that was just last. Yeah.
Okay, so with those, the reason for those difference in temperature is basically had to deal with the nanoparticle, the lipid nanoparticle that the lipid nanoparticle that the vaccine, the basis of the protein spike of the virus was encapsulated in that particle. So there's a few different structures, not structurally to the spike protein, but to the nanoparticle itself. So that's what led to the difference in the temperature when it comes to in terms of storing the vaccine. But as Dr. Schultz just said, it seems like there've been some changes made, and now you're able to freeze it in the regular refrigerator.
Are there any vaccines that require only one injection?
I believe Dr. Holden wanted to say something, and then I'll answer that question.
Thank you.
Sure. I just wanted everyone to be aware of, there are many challenges to this whole COVID vaccine landscape and to COVID-19 itself. And one of them is that information is coming out literally every day. We're following the science, and we have to make sure, for example, I'm sure Dr. Schwartz and also Clement, we get information on special bulletins that come into our inboxes as being patient care providers. And so, this information that we're telling you today may change tomorrow. That's the bottom line. So we're trying to give you, the most up-to-date information that we're aware of, as science is giving it to us. So I just wanted to have that preface for all the information that we're giving, because we're literally getting information every single solitary day about this virus and about the vaccines.
Thank you so much, Dr. Holden. That's incredibly important to make note of.
I believe there was a question about one injection.
Yes.
So when you say one injection, you mean one dose?
Correct.
Yes, so the Johnson & Johnson one has the capability for that. And as the FDA just published this morning, I believe in all geographical areas, it's about 66% effective. So that's the only one that we have in the market so far.
Okay. Do you know if there's a safety difference between each of the types of vaccines?
No. So as a clinical trial data and the data that CDC has been collecting as folks are getting to receive the vaccine itself for the Pfizer, I believe, is about 95% efficacy rate. Moderna is about 94 point something, which roughly is about the same, about 95% rate. They both have similar common side effects in terms of if anyone here has taken the first dose or the second dose. The collected evidence show that the side effects are very common and similar to both vaccines.
Great.
The other piece I think that it highlighted in terms of efficacy, this 66% versus 94, 95, that's against COVID at all, getting any infection, even if it's mild. So people look at the Johnson & Johnson and say 66%, that's terrible compared to the other two. But the other thing that it shows is essentially 100% effective against severe disease and hospitalization. So it's still very effective even with the one dose, even though they say 66%, that's again, any COVID, compared to severe disease.
Yeah, and to follow up with that, there are other vaccines on the market right now that we take every year, such as the flu vaccine, that's roughly less than 60% effective. So 66% efficacy rate is quite good. So as that show says, there are going to be folks that say, hey, you know, the Moderna and Pfizer is at 90% rate or 90+% rate, and how come this is just 66%? It's still, as Dr. just indicated, is still very good, especially when it comes to getting infected with the virus and being severely sick from the virus.
Can I just also jump in, since we're on this topic? I think it follows that, excuse me, the 95% efficacy rate, 66% efficacy rate doesn't mean that you cannot be an asymptomatic carrier of the vaccine. So that's why even though you get the vaccine, you can still be a carrier, meaning you could still pass it on to someone else. So that's why it's really important to still continue those safety measures that we've all been collectively doing, hopefully, mask wearing, hand washing, physically distancing, being in a ventilated room, because there's still that possibility. And studies are still being done as to, you know, how big that possibility is, but there is that possibility that we have to be mindful of.
Once you get the vaccine, are you immune to COVID? I think that kind of goes along with what you just said.
Yeah, I think Dr. Holden just answered that question perfectly, in the sense that, you know, CDC still recommends that, you know, as Dr. Holden just said, you know, wash your hands, social distance, keep 6 feet. At this point, we are still collecting data. So we do want to make sure we are still taking those precautions before somebody gets first and the second dose and goes, hey, I'm free to walk out with no mask or social distance. So please do so even when you get vaccinated.
So is this vaccine?
With that being
Go ahead.
Oh, I'm sorry, I was just going to say, that being said, it's still extremely, extremely effective, right? So
yes. Yes.
We really want to, I think, take that point home more than anything else. Is the reason to get vaccinated is this could end this pandemic, and the sooner we get more people vaccinated, the better that chance is. So to have this 94-95%, that's better than all the other vaccines that we have, and we've eradicated diseases completely, such as, you know, at least in the United States, polio, and for a while we were close to measles, with vaccines that are less efficacious than what COVID has been.
Correct. And, you know, when they say 94-95%, that means there's a 94-95% chance that you will be protected from getting serious to, you know, the deadly effects of COVID. And so you're protecting yourself. So that's why we're stressing that this is something that's important for all of us to be able to do that.
And also to keep in mind that, you know, based on the clinical trials and the data that we receive, it takes several weeks or a few weeks for the vaccine, for the immunity to really kick in, right? So that's why it's really critical that you continue to social distance and, you know, and take all the precautions that's needed at this point.
We just received a good follow-up question in the chat with regards to this. The question is, how can you be immune from the vaccine and still spread the virus? Do the antibodies kill the virus in your body?
So that's a very good question. So as we just indicated, just taking the vaccine doesn't mean that you get full immunity right away, right? I believe, and Dr. Holden, Dr. Schultz, you guys can correct me if I'm wrong, I believe there's been some instances where people are carrying the virus in their upper respiratory system, right? And you can still spread it. So that's why we are encouraging folks, even after you get the vaccine, to take the precautions, social distance, wear the mask, and allow the vaccine to do what it has to do for it to reach its full immunity. I believe for both the Pfizer and the Moderna, after the first dose, it takes about 14 days for immunity to kick in. So that's why it's really critical that we continue to take these steps. And Dr. Holden and Dr. Schultz, you guys can add to that if I'm missing something.
No, that's correct. And, you know, the full 94-95% efficacy is usually a couple weeks after the second dose for those two as well. And part of this answer is we don't know yet. we have this potential risk that you could still be an asymptomatic carrier even after getting the vaccine, but that's part of why we're still doing the studies. And so, there may come a time where they say, no, actually you are essentially cured. You can't be a symptomatic carrier once you get the vaccine, but those studies are still ongoing. And so we are exercising an abundance of caution in continuing to do the other masking, physical distancing, hand washing situation.
So is this vaccine a one-time deal, or is it something that needs to be taken annually?
We don't know, right? As Dr. Schultz just said, we don't know. There's a lot about this vaccine that we're still collecting data. We don't know. But if it turns out it's an annual routine that we have to go through, we get a flu shot every year, right? So this may become one of the norms for us as we move forward. But the direct answer is we do not know.
And part of that might depend on variants and how widespread those become as well, and whether the current vaccine, provides enough coverage against those variants. One thing to highlight is that with the mRNA vaccines, it's actually really incredibly easy to make the genetic sequences in a lab to put those in. So the technology that takes more time and that has, again, been around for many years is more about the way it's introduced into the body with the nanolipid profile. And so they can make in a lab a sequence for the new variants in a day or two and implement that into a new vaccine. It's just a matter then of production. So I think that's one of the positive things to take away too, as we're looking at these variants and will things have to change, that there is, that we can quickly shift if we need to in the future.
Right, and I believe that current data shows that once you have the 2 doses of the vaccine, either the Pfizer or the Moderna, that you're protected for up to 5 months. And again, they're continuing to do studies to see if that, gets prolonged, of course. But where we are right now, I believe we're at 5 months of protection once you get both doses of the vaccine.
And as Dr. Schultz just mentioned, there are variants of the viruses. I do believe Novavax is working on the vaccine as well. And their clinical trial, phase 3, is showing some promises to be effective against some the UK and the South African strain. So fingers crossed. Let's see what happens as we continue to get more research and data out.
Thank you very much. The last question in this category, the medical field has historically experimented on and exploited Black and Brown communities. So why should folks trust this vaccine now?
That's a very good question. And I think that speaks to the core of the reason why we're having this discussion today, right? What I often tell people is that Black people and people within the Brown community and people within the minority community are not afraid to get the vaccine. They know their history of how they've been treated in modern medicine in the US, right? So we do have to speak to sort of that history, the historical fact that modern medicine has not been really beneficial to Blacks and other minority groups in this country. But to that fact, we also have to speak to the data that's out there, to the science, and the science simply shows that both vaccines that's been administered at this point is quite effective and it's intended to do what it's supposed to do. So I'll open that to Dr. Holden if there's anything else that you'd like to add to that.
Yeah, sure. I mean, I agree with what you say, Clement, what you just said, Clement. And, there is historical data where Black and Brown people have been actually mistreated in medicine. And I think 2 main factors have turned the tide more recently. One are just the fact that, and the realization that these instances did happen in the past, and that there are many checks and balances on many levels, federal levels, state levels, local levels, where these discrepancies or differences are being investigated and in many cases prevented. And we see that, for example, in New York City, where there were instances of the vaccine being put in vulnerable populations, Black and brown populations, more vulnerable populations, the distribution, and we found out that those people were not getting the vaccine. So basically, that's an example of a local check and balance, so to speak. That's number one. And number two, as we increase the diversity of the healthcare workforce, we have more Black and brown people at the table who can say, wait a second, there's something wrong with this, and really be in with the policymakers and the decision makers and be able to raise red flags or concerns about studies that are being done or regulations maybe that aren't being followed as well as could be.
Thank you. That was certainly very helpful information. And so now with that, we're going to discuss vaccine side effects. So I'm going to address these questions openly to our panelists to address the research coming out as well as your own personal experiences as relevant. So the first question is, if I get the vaccine, will I experience post-COVID effects?
So regarding, I had my first dose about 3 weeks ago, and I'm due for my second dose next week. After the first dose, as the data suggested, there was a pain at the site of the injection. Sore arm, lasted for a night, and the next morning I was, back to 100% in terms of the pain. Some folks may experience other symptoms, but so far, that's what I witnessed as an individual that took the first dose. The second dose, on the other hand, the data shows that people are coming down with some fever and chills in that particular realm. So those are sort of and fatigue as well too. So those are some of the common side effects that we have been observing and documenting.
Right. There also is there's something called the Vaccine Adverse Event Reporting System, where folks who have had the vaccine, if they have any adverse effects, they're encouraged to report any symptoms. And actually, once you get the vaccine, they'll give you a card with a toll-free number, excuse me, to call if you have any symptoms. And based on a report that came out actually February 19th on the 14 million vaccines that have been distributed in across the country in the U.S., they basically found that common side effects were, as Clement said, local injection site, pain, maybe a little swelling after the first vaccine, and after the second vaccine, headaches, fatigue, maybe a little nausea, diarrhea, maybe a little diarrhea, but mostly it's a little fatigue, and also, again, the local site, injection site pain.
And I've gotten both of my vaccines. They were Pfizer, and the first one was just a little bit of arm soreness. That was about it. The next day, I think I felt a little lightheaded. When I got up, I drank some water and I was fine. The arm soreness lasted a couple of days. And then after my second dose, my arm soreness was actually less. I felt a little bit tired and a little bit achy back, but I was fine to work the whole next day. And that it lasted about a day, and I had no side effects or complications. So, these vary from person to person. And so, but on the whole, the side effects are generally pretty mild and consistent with any other virus vaccine that we give.
Right. And I also had the vaccine, the first dose. I did have soreness at the site that lasted probably about 3 days. And after the second dose, I had soreness at the site. I also had just a mild headache, a little bit of chills, and some body aches. And after taking Tylenol, just saying, okay, let me lay down instead of going like the Energizer Bunny, it did clear up within 5-6 hours.
Deaths have been reported within hours after taking the second dose of the vaccine. Is there any truth to this?
So we're hearing in the news about deaths that have been occurring in other countries, Norway, in Germany, for example, even here in the US. But again, through that adverse event reporting, which can be anyone to report these. It could be physicians, it could be actually patients, it could be their family members. So again, out of 14 million recipients of the vaccine, both doses of the vaccine, in between December 14th and January 13th here in the US, there were 113 reported deaths. 78 of them were folks who were in long-term care facilities, so whose health was more on the frail side, and 35 were people between the ages of 25 and 91 who were in the community. Of those 35 deaths, there were found that they happened between 0 days, so immediately, versus 20 days out from taking the first or second vaccine. And the most common causes were heart attacks, strokes. There were also a couple anaphylactic reactions. So that's where the person's body reacted to something in the vaccine that caused them to drop their blood pressure or to their mouths to swell, and they didn't have adequate airway. But those were the main reasons, and it's unpredictable. There was no way to say predict who was going to get to die from this vaccine. The only thing is anyone who's had a previous reaction to the components of the mRNA vaccine are cautioned and have to sign a waiver before they get it.
And we have a phrase in medicine, I agree with all of that, Dr. Holden, that correlation does not imply causation, right? So some of these deaths very well probably would have happened anyway, right? The heart attack, stroke, and not caused by the vaccine. And we always have to put this in the context of over 500,000 people have now died from COVID. So any mild side effects that you experience, or even more severe side effects, again, the death, it's hard to attribute those directly to the vaccine in any way, shape, or form. We're really saving a lot of lives with.
Right.
Yeah, and I do believe if we are speaking to the same report, Dr. Holden, I believe the conclusion was that there was no link between the deaths and the vaccine, and Dr. Holden did such an excellent job breaking down the causes of the deaths. So CDC and our state government is doing their due diligence to do what they have to do in terms of when a death arises and going through autopsy and getting the medical reports to review and make sure that these deaths are either attributed to the vaccine itself.
Right.
There are anti-vaccination sites that are raising issues of things such as raised aluminum levels and other chemicals in the vaccines. Can you explain what this is?
Yeah, so in most vaccines in the past, such as anthrax or T-Tab and Hep A, Hep B, have ingredients known as adjuvants. So these are your aluminum phosphates, or potassium or aluminum, and these are very small amounts that you could possibly also find in an infant formula of a baby. But to speak directly to the Pfizer and the Moderna, based on the ingredients that I've seen so far, once again, Dr. Schultz and Dr. Holden, you guys can correct me if I'm wrong. I don't think I've come across in the ingredients any adjuvants in those. In most cases, the ingredients include the lipids that we mentioned as used as the nanoparticle. There are some salts ingredients in there as it relates to potassium chloride and those type of components, and then sugar, and I think, and the mRNA itself. So I think, and that goes across for both vaccines. So I mean, that's the ingredients that I've seen so far. So I haven't seen those adjuvants in there yet. But once again, as we have learned so far, the information changes. So maybe Dr. Schultz and Dr. Holden may have something different that they have come across.
I agree with you. I haven't read of any toxic levels of, any aluminum, for example, in this vaccine. And yeah, I agree with Clement. Right now, as it stands, we don't have any of that information. It hasn't been revealed to us. And so, we're, again, trying to go by the science here and teach you and inform you as best as we can.
Thank you very much. So we talked a little bit about side effects after the doses. Should people plan on staying home for a few days after they get either their first or second dose?
So I'm going to I guess I'll take this question. So I would definitely say after the second dose, one should plan to lay low for about 24 hours, 24 or 48 hours, just because they don't know, what sort of side effects they may have. And as physicians, that's what we were told at our, so we were scheduled to get the second dose and then advised to take the next day to sort of rest before coming back to work. Not everyone did, but that's what we were advised.
And I think that the overall side effects that are bad enough to keep you home from work are pretty limited for most people. So we're finding that those severe side effects are much less common. So it's good to plan ahead. It's good to not have your entire staff immunized the same day, because then you might have multiple people out and not be able to for one individual, just know that there's a possibility you might have those side effects, but it's certainly not a guarantee that it's going to happen. You might.
Yeah. I think Dr. Schultz was going in and out, but as he was saying that it's important to stagger the staff, just because, I know, for example, my attending staff, everyone wanted to get the vaccine as soon as it came out. And so we had to stagger it so that people got their first and second dose, so that we had someone to cover the emergency department. So you want to do the same thing for your programs.
Great. Again, very helpful. So the last question in this category is, what does the COVID-19 vaccine do to your reproductive system? Is it safe for someone who's either trying to or wants to have a baby?
So those are questions right now that it's suggested you talk with your OB. It is not a contraindication, and there are studies going on right now looking at giving vaccine to those that are in the 24 to 34 week gestation to confirm safety. It's not a contraindication, but it is a discussion. And it doesn't negatively affect your reproductive system. I think another point to realize is, even though these are genetic vaccines and mRNA, they never enter the nucleus. They don't get incorporated into your DNA whatsoever. They are just part of your genetic sequence that produces proteins, and those proteins are what prompts the immune response. So again, it does not enter into your DNA. It does not become part of your genetic sequence whatsoever.
Okay, very helpful. So as we wrap up this section, we've actually just been joined by New York City Council member Mark Levine. So we'll hear from him and then return to the remaining questions. New York City Council member Mark Levine has represented the 7th District in Upper Manhattan since 2014. Serving as the chair of Council Committee on Health and as a member of the Progressive Caucus, he is a leader on many issues, including tenants' rights, healthcare, transportation, education, economic justice, and the environment. Councilmember Levine has actively worked to keep the city informed about the COVID-19 vaccine, including hosting forums similar to this one and frequently disseminating the most updated information on vaccine eligibility and availability, and has worked to address some of the largest frustrations with the vaccine rollout. We thank him for his work in this space and are thrilled to have him here with us today. Welcome, Councilmember Levine.
Well, thank you so much, Kelly. I'm really honored to be part of this discussion. I have to say, Dr. Holden and Clement, that was about the best presentation I've ever seen. on this vaccine in such a clear, powerful way. I think we might have to take this show on the road. Really, very, very, or maybe at least if you're recording it, we can play the video. Thank you for that. Thank you, youth workers, for what you are doing and have done for young people in the city, a generation of young people that's having a tough year that I know depends on you more than ever. And I know you've been there for them throughout this crisis. And for that, I'm grateful. I know that you've also taken risks. And it's why that we fought to get you this vaccine, and why we hope that you all will take it now that you have this opportunity, respecting that you have questions and doubts that I think today is designed to answer. I have a little connection to this world as well. I spent several years working at what was then called the Afterschool Corp. Now it's the Expanded School. So I've worked in this space and just know how amazing youth workers are. I guess I'll just say a little bit about the big picture about where vaccination is in New York City and where the virus is in New York City, and what it means for you and your families. I think some of you are from other parts of the state, but I think much of what's happening here applies everywhere. And you know, there is still reason for caution and concern in the weeks ahead, but also some really good news. Supply is increasing of vaccine. It's going to be easier for you to get an appointment now. There still isn't enough supply for everybody, so you should be prepared that it might take a few tries at the web scheduling system, on the web scheduling systems. And if you'd like, we can talk more about kind of good suggestions and strategies for getting an appointment. But more supply is coming now, and a lot more is going to be coming in the weeks ahead. And you probably already spoke about this morning, but a new vaccine from Johnson & Johnson is shown to be very effective and safe. And the company has said they'll have 20 million doses ready by the end of March. So that's a lot more and a lot sooner than we had thought. And I really think that by April, probably, there's going to be more appointments available than people who want them. So that's a different problem, and one we also have to address. But I do think it's good news for all of us who want to make sure everyone who wants a shot can get one. I'm really fighting to make sure that there are more places and more ways and more times for people to get vaccinated. And so I'm fighting for vaccination locations in community centers and NYCHA and public housing, in churches and houses of worship, in senior centers, in the neighborhoods that are close to where people live and are trusted by people in the community. I'm also pushing for mobile vaccine vans to really go into neighborhoods, again, to be where people are. And I think that you as youth workers, I know today is mainly about helping you think about getting a shot for yourself, but I hope that you'll also be ambassadors to people in the neighborhoods where you're working and living, and explain the options for getting vaccinated. And so I'm sure you'll welcome the idea that we do need more vaccine locations in more neighborhoods all over the city. You know, I still feel obligated to remind everybody that there's a lot of coronavirus still spreading in New York City and New York State. It seems like we're coming off the highs of mid-January, but we're still seeing 3,000 or 4,000 cases a day in New York City, which is a lot. That's a lot of new cases. And I don't know if you've spoken about the new variants that are a little more contagious, one of which is the one that was first discovered in Britain. It's now in New York City. And it seems like a growing portion of the cases of COVID in New York City are caused by this variant. So that's a real wild card for all of us as we think about the weeks ahead. And so while we can be optimistic about the vaccine coming, let's all continue to take this disease very seriously, because it's still out there. It can affect younger people, and we all have to continue to be cautious. So I think I'm going to stop there. I'm happy to stay if there's. I'll chime in on any questions that it would be appropriate for me to answer. But I want to thank all of you again for having me.
Thank you so much for those remarks, Councilmember. We appreciate your time and your support. So thank you so much for joining us. And now we will go back to the questions. We've received several questions around vaccines for special populations. So Steven, this one's directed to you. How does this vaccine affect people with pre-existing conditions?
Those are the people that need this vaccine the most. People with pre-existing conditions we know have more complications from getting the COVID infection, and that's why the comorbidities are now the next stage of vaccination after healthcare workers, is that we're trying to prioritize those that are higher risk conditions. So it helps.
Is it safe for individuals with asthma?
Yeah, there's no complications reported with asthma.
How soon may we expect the vaccine will be available to youth?
Well, currently Moderna is available down to 16 years of age. So there are some folks that would be in that category for pediatric youth that would qualify at this point if they have the certain comorbid conditions that would qualify them. There are studies going on for the 12 to 17 year age group right now, and those seem to be going well. I anticipate that we'll be able to extend that relatively soon. As to how soon, I don't know. And then as things continue to progress well, the studies will continue to be progressed to lower and lower ages.
Given the heightened fears expressed by many educators, would it make sense to vaccinate children as a precaution?
So children are not immune, right? Even though we tend to see that kids are less severely affected than adults, they still can get serious complications from COVID. There are a certain number that get multi-system inflammatory syndrome of children that can be deadly. And so we certainly think that vaccinating children are important for the kids themselves, but also in part of herd immunity for protecting adults as well. And so that's why the rollout is now occurring to try and vaccinate younger and younger ages. But again, those studies are ongoing.
Our professionals also want to know more about the relationship between the vaccine and the COVID infection. So after taking the vaccine, will you test positive for the virus or positive for antibodies?
You won't test positive for the virus. The antibodies, I guess I'm not 100% sure about that. I would maybe defer to Dr. Nash and Dr. Holden.
Right, I think tests actually haven't been done. That's one of the studies that are being done about, do you test positive for the antibodies, but you definitely do not test positive for COVID-19 infection unless you have infection. So for example, I had a patient who had the first Pfizer vaccine actually a week ago, and came to the emergency department with body aches and ended up testing positive for COVID-19. So was that because he was exposed before he got the virus and it was incubating in his system before he got the vaccine, and it was incubating in his system even though he got the vaccine? Or did he have a variant? I mean, we just don't know. So that's why you have to be very vigilant about any new symptoms that you have, even though you've had the vaccine part 1 or part 2.
So Dr. Holden, if you have already had COVID, does the vaccine interfere with your immune system's natural response?
Studies have shown that it does not interfere with the natural response of the immune system. And, we're talking about COVID, the risks, the benefits. Some people get a very bad case of it. Some people have mild cases. So you just don't know who's going to get which case. Also, once one has had COVID, you don't know how long their symptoms are going to last. So for example, they're what we term long haulers. So these are people who had COVID and they may have had mild symptoms, but they're still suffering with fatigue, with headaches, with shortness of breath, need oxygen, and especially the emotional challenges that people have after getting COVID, brain fog, etc. So it's important to when you're thinking about this vaccine, to think about those side effects and do a risk-benefit analysis on that.
And if I can add to that, there's been some questions in regards to if I get COVID, do I need to get the vaccine? Yes, the answer is yes. So I just wanted to include that as well.
Yeah, thanks, Clement. And it's important also to remember that it's recommended that if you have COVID, the recommended time period is 90 days before you actually get the vaccine. Also, if you had COVID and you had some sort of intervention, like the monoclonal antibody treatment or convalescent plasma treatment, and these are all treatments that have come and are still being tested actually in clinical trials at different sites at different hospitals, but it's also recommended that you not get the vaccine until 90 days after any of those interventions have been administered.
And the thought is once you've had COVID, you're immune for 90 days in all likelihood, except for, again, we don't know the variants, and that certainly could reintroduce an infection as well. But that's part of the reason for this 90-day window. But it is still recommended to get that vaccine even after you've been infected. And there are studies going on as to whether 1 versus 2 doses of vaccine would be appropriate in that situation as well. But for now, it's the 2 dose.
Can you get the COVID-19 again after you've developed antibodies?
Yes, it is possible. It's rare, but it's possible. And as Dr. Schultz just mentioned, we're not sure how long after one has COVID, their antibodies, their natural antibodies last. So number one, and number two, with the variants, as actually the councilman mentioned, we're not sure the variants, the severity of disease that can be caused by the variants. I mean, he mentioned that the UK virus variant is in New York State. So that's another reason why we have to be very vigilant.
Yeah, and if I can add to that, I have a family friend that has already tested twice for the virus. So yes, based on my personal relationship with somebody who's had it in the past and then got it again. So yes, so please do not think if I get it once, I'm immune to it and I can get it again.
Very good to know. If someone is young and generally healthy, and they work with young kids that seem to not get as sick from COVID-19, and there's a limited supply of vaccines, why should that individual get vaccinated?
Well, that's a very good question. It is true that there is limited supplies, but as I said at the beginning of the presentation, if you work in the environment where you are eligible to receive the vaccine, please go get it. We highly recommend that you do that. So you may feel guilty that you're young and you're strong and you're taking vaccines away from the vulnerable, but you're also not immune to it. So if you're eligible to receive it and you work in an environment that the state deems as eligible and is giving you the opportunity to get vaccinated, please go ahead and do so.
Yeah, that's well put, Clement. Well put.
Thank you. So lastly, what resources do we have for disseminating information about the vaccines? So we had a question, is there a family-friendly brochure that we can share with staff and families to help them better understand? We do have a website section on our website on the vaccine. So we're going to put that in the chat now, and there's some helpful resources to share with staff and families.
I mean, I'll go first. I always believe that, .gov websites are the most reliable, and you want to make sure that you have reliable information. The CDC does have sections for for lay folks, so non-health professionals, that definitely I would recommend cdc.gov for anyone to visit, and also your health department, the New York State Department of Health, and also your local Department of Health websites are actually more in tune with what's happening locally. So I think that those are extremely important sites to go to.
And I will also add that if you have a relationship with, if you have a personal doctor, that you should seek advice and try to get as much resources from them as possible, because they more than likely they may have the most current information as well.
And most local health organizations also have information and links on their websites as well, because I know we are getting inundated with a lot of these questions. So definitely check in your local healthcare provider's website as well.
Thank you for those great resources. Now, we'd like to move on to questions that have been submitted in the chat today. If you would like to unmute yourself and ask a question, you can raise your hand using the raise hand feature and we can call on you. We have about 25 minutes remaining, so please keep your questions brief to assure that we can get to everyone. So the first question that we have is around COVID precautions. So what procedures are there to limit exposure in the work environment for staff and students?
So I think the precautions are the same for the general population as well. So continue to wash your hands, face covering, social distance as much as possible if you're able to. But you know, for folks working with children, I'm sure the social distancing part can become difficult. So the other two precautions becomes very critical in terms of face covering and washing your hands as much as possible.
And I also add that ventilation, being in ventilated spaces also has been found to be helpful. So avoiding closed spaces and making sure there's some ventilation has been found, in addition to what Clement mentioned about the hand washing, wearing the mask properly, and now they're also recommending wearing 2 masks. So that came out, I believe, 2 weeks ago, wearing double mask, and also the physical distancing.
And I will say that OCFS also has interim guidance on their website too, that is very helpful. I believe it was last updated in June. I'm not sure if they've done any updates since, but it's good information.
Thank you. And yes, that is up on our website as well. We had a question around sites, specifically in New York City. So Councilmember Levine, this might be a good question for you. How can someone get their house of worship or other location as a vaccination site in New York City?
Well, thank you for raising this. I just think it's so important that we do have places like houses of worship where we're vaccinating, both because we want to be close to where people live, but also because I think it's a great way to build trust. I think that the familiarity with, if it's your local church and the local pastor is perhaps promoting vaccination there, that it's just one more way to make people feel comfortable with this. And so great to hear that you have someone who's interested in having their church offer this. At the moment, there's not a lot of movement on new community-based sites, unfortunately. I'm fighting to change that, mostly because supply is not turned around yet. So I think what I would suggest is that you reach out to a local elected official, your city council member or state assembly member, and ask them to push this either to the city or the state. And if you're in Uptown Manhattan, I'm not sure where this person's located, by all means, you're welcome to reach out to me, and I will put my contact information in the chat. So again, if you're in Uptown Manhattan, happy to help on this one.
Thank you so much, Councilmember. Some schools are supplying children with plexiglass trifold boards to carry. Are these effective?
I don't know that we know the definitive answer on that. It's not as effective as masking and social distancing, but in certain situations for lunch and things like that, I know that it's thought to be more helpful than nothing. And so I think there's still some research in determining how effective some of these physical mitigation matters are, but physical distancing and masking are probably the top two.
Right, I agree. Also, you know, one way that COVID spreads is through the respiratory tract, through the eyes, through the nose, through the mouth, but also it's a fomite, so it can live for some time period on objects. So the plexiglass is sort of containing it in that sense, from spreading in that way. And that's why it's also important to wash your hands very frequently, because washing the hands with soap and water can actually deactivate the virus. And so that's why it's important that schools and after school programs have adequate soap and sinks with running water so that students can wash their hands frequently.
Thank you. We've had several questions come up in the chat around vaccine specifics. Does anyone know if they are tracking sequencing from all the tests that are positive?
They're not tracking all, but they are tracking a sampling of the different ones to see if the variants are encroaching in our places of where we live and work or not. So that's how we've identified the UK virus locally. It's not every test that gets sent for this, but you know, a certain amount are.
There have been, there seems to be some confusion around the immunity after receiving the vaccine. So one person asked, is it true that after 5 months you are no longer protected or immune?
So we don't know. Tests are still being done, and you know, I know it's incredibly frustrating to say we don't know, but you know, tests are in progress. And as frustrating as it is for you all, imagine those of us who are actually taking care of patients to, you know, be getting information in real time to take care of the patients. But we do know that so far the science has shown that up to 5 months after the vaccine, one is protected. But again, the tests are still being done. Studies are still being done about that.
That's all we know because that's all that we have data on, right? So we're presuming it is effective longer. It's effective at least 5 months, but more data will come.
Do doctors or other healthcare professionals receive money for pushing or giving the vaccine?
I will say absolutely not. I have been part of quite a few committees at the city level. I'm actually working with the 7 medical schools in New York City to start a COVID vaccine ambassador program for pre-medical students so that they can reach out to their communities with accurate scientific knowledge about the vaccine. But I'm just very passionate because I've seen what this vaccine, what this virus can do and how it could wreak havoc. You know, I've been practicing emergency medicine for 25 years now, and I've never seen the amount of disability, death that I've seen over the past, you know, a year. And I think that, you know, it's just that passion that I have, especially seeing how it has been affecting, you know, my community, that I really, you know, this is all voluntary on my part because I'm really very passionate about it. And they're a group of, you know, very committed physicians who just want to get this over with, basically, like you all do, and try to get as much reliable information that we can out into the community so that people can make an informed decision about the vaccine and other treatments that are available for COVID-19.
And I would 100% echo that. No, we are not reimbursed for the vaccine.
Thank you. If you received no side effects at all after both shots, does that mean it didn't work?
No, it does not mean it didn't work. It still very likely did. You just were lucky not to have side effects.
Yeah, as we said, the side effects varies in the individuals who are taking it. So just because you're not getting those sort of common side effects does not mean it didn't work. It just means that you're one of the lucky few people that did not get the body aches and you know and the fevers and the pain. So count yourself as very lucky at this point.
If you had COVID, will your reaction to the vaccine be more severe?
Potentially. And again, this is where there's some studies going on because your body's already primed to respond and already has that immune response ready to attack. You might have a little bit more severe. And so that's where the studies are going on to see if one dose is sufficient or if you still need the 2 doses after you've been infected.
Great. And Dr. Schultz, you had mentioned that one of the vaccines is now eligible for children as young as 16. So what is the recommended direction in planning for residential summer camps and interactions with children if young children are not eligible to receive the vaccine?
So by us as adults getting immunized, we're protecting kids. Right. And so you're protecting your family, you're protecting your friends, you're protecting your community, your coworkers. That's the most important thing, why it's really important that those that are eligible get the vaccine. Those that aren't eligible yet, we're doing them a service by us being protected. And when they are eligible, we'll work hard to make sure they can get the vaccine as well.
Do you know if there's any data available statewide or nationally about the incident rates of COVID-19 within after-school programs or childcare in general?
Not that I'm aware of. I mean, I pretty much try to keep myself updated as much as possible in terms of incidence rates. And I don't think it's broken down to that level yet. Maybe Dr. Schultz and Dr. Holden may know otherwise, but I haven't come across anything like that.
I do know that there is data on school mitigation efforts and some studies that came out of Georgia and Wisconsin. And the big takeaway was that as long as you follow those physical distancing, masking, hand washing, mitigation efforts, the incidence is very low. I don't have the exact numbers on hand, but the key is you have to do all the precautions.
Great. Now we have a couple of questions on appointments. Why is it so difficult to register seniors for the vaccine?
I could jump in on that if helpful. I have to say that the registration process for vaccination, at least in New York City, and I think statewide, has just been absolutely unacceptably complicated. It requires checking many different websites. It requires hours of time. On each site, you have to register again, do an eligibility check again. If you don't have an email address, for example, forget about it. You're not going to get through. And it's really excluding a lot of the very vulnerable people that we should be prioritizing. So, one thing that we need to do is just simplify the web registration process. There should just be one simple, easy website where you can see schedules for every single provider. But honestly, we have to get beyond the internet as a way to schedule. We need teams on the ground in communities who are signing people up, even going door to door. Something that's starting to happen now a little bit, which we need a lot more of, is taking some blocks of appointments and allowing community-based organizations to fill in their constituents for those appointment slots. And that is really a great way to reach people that are just not going to be on social media, seeing the information. And it's actually possible that many of your nonprofits, some of them could even be part of this kind of work because you're in the neighborhoods that we need to be vaccinating more in. And something I'm pushing for is what we did for the census, where hundreds of community groups were actually contracted to do outreach and promotion for people to fill out the census. And it worked. We had really good census numbers, at least in New York City, despite it being the middle of a pandemic. We haven't had that yet for vaccination. that's what we need. And this actually might be something I can, work with you as a network, because I know you're in all the key neighborhoods, and you have, your trusted leaders of getting you a formal role of actually scheduling for people that you're in touch with. That's the best way, I think, one of the best ways to promote greater equity in the sign-up process.
Great.
Can I also add that, there's a known digital divide amongst communities of color and elderly populations. And so to rely on a website is really, not efficient to get the word out to those communities. Using radio, for example, pop up at, as Councilman Levine mentioned, churches and local community-based organizations. That's the way, and the neighborhood sort of van. Those are the ways to really, barbershops, beauty parlors, you have to kind of think of where you can get the most bang for your buck, so to speak. So, a phone number, there have been phone numbers set up and they're busy, or the person's on hold, or they get caught in a loop, and it's very frustrating. And it's sad that would hinder someone who wants to get the vaccine from actually getting it. So I think anything that we can do to make it easier on many levels, it's definitely will be helpful. And another population are homebound people. So those who are homebound and can't even get out of their house, we need to think about how we're going to vaccinate them, because chances are they're exposed to home health aides who have been, perhaps not vaccinated. So there are lots of different factors when it comes to covering vulnerable populations for this vaccine.
Yeah, and if I may add to that, even for our seniors who are savvy enough to jump on the website and register. I mean, I had to do this for my parents. They couldn't type fast enough. They couldn't enter the information fast enough to even register themselves. So they had to call me, stay on the phone, and for me to go ahead and enter the information as fast as I could, because I think it only gave them about 3 minutes to enter all the information they needed. And they don't type fast enough to be able to input all that information. So that's one of the issues as well.
Thank you very much for that. Very helpful. Is there some place after school staff can go other than the state setup sites like York College?
I can jump in. There are many options. There are in Brooklyn, in the Bronx, and in Staten Island, there are mass vaccination sites that are open to anyone eligible. You mentioned York College in Southeast Queens. That's going to be made available to the whole borough of Queens starting Saturday. In Brooklyn, you probably mentioned Medgar Evers College. It's now just for Central Brooklyn. It's going to be made open to the whole borough again on Saturday. Yankee Stadium is already open to the full borough of the Bronx for anyone who qualifies, including after school workers. And Staten Island now has Empire Outlets. There's a mass vaccination site there, which is open to the whole borough. That opened yesterday, I think. So it's a little spottier in Manhattan, unfortunately, and we're fighting to change that. But there are many New York City Health Department run hubs and New York City public hospitals and public clinics that are also open to youth workers and anyone eligible. It is hard to get an appointment, and this is something that we have to fix. But you do have a growing number of options, and especially if you're in one of the outer boroughs of the city, you have these mass vaccination sites, which are posting a lot of new appointments, and it's probably your best bet right now.
Great. Is that the same, do you know, for upstate New York, for the rest of the state?
Yes.
Yeah,
so FEMA, the Federal Emergency Management, has given us, given all over the country, but given local governments enough supplies to set up special sites. And so the two in New York City are at York College in Queens, Medgar Evers in Brooklyn, but I think there's going to be 6 or 7 statewide. I don't know the other locations, but these are really focused on equity, and they're all being placed in neighborhoods that are underserved. And so this is a great option for the youth work community. And I'm sorry I don't know the locations out of the city. Someone else can probably, Clement probably knows the upstate outlook, but this really is a great option for all of you.
Yeah, I do know that there's the Dome in Rochester, but outside of that, I'm not sure of all the different sites. And you're right that county health departments are running clinics, and you know, some pharmacies are vaccinating certain eligible people as well, in addition to the hospital system.
And the pharmacies are only 65 and over. They're a great option for seniors, but not yet for people in other categories.
Dr. Schultz, are there any recommendations for getting appointments that are more effective in rural areas?
Not really. It's checking these websites and checking in with your local county health department and you know, pharmacies for those that are older, as mentioned by Mark. And so it's the same process everywhere. It's just different locations.
Okay, thank you. Some after-school programs are depending on Purell rather than soap and water. What is best?
If soap and water, if would be the top recommendation. As I think Dr. Holden mentioned this earlier, soap and water has the capability, as we know based on science, to break down the virus. So if you have the ability to supply soap and water, I would recommend as a top choice. But if not, I think anything that has the ability to hinder the effectiveness of the virus will do so. If you can only use Purell, then provide it. But I believe soap and water will probably be the recommended choice for a lot of people.
Can I just add that anything with greater 70% alcohol is known also to break down the virus. I think the problem with Purell is that that especially kids may not use enough of it, and they may not actually, you know, get in between their fingers and on the back of their hand. And so it's very important to, if Purell is the best alternative right now, that students are instructed that they have to use a copious amount and make sure that they rub it in between their fingers and the back of their hand, and, you know, for 20 seconds. So really to show them how to use the Purell to make it effective.
Thank you. And Dr. Schultz, should children also double mask?
Yeah, that is the recommendation. Yep.
Excellent. Now, I know we addressed some of these at the beginning, but we're still getting some additional questions on eligibility. Dr. Nsiah, can you reiterate this very quickly in our last few minutes? Are all after-school providers considered eligible, or does your organization need to be licensed by OCFS?
Well, so the language used by the state is that you have to be licensed, registered, approved, or legally exempt program. So if you fall within any of those categories, then you are allowed, your staff is eligible to receive the vaccine. I was on the phone with the state yesterday in terms of non-licensed, and the answer I was provided was that if they can show evidence that they are approved to provide the services, then they are eligible to receive the vaccine. So that was the information that I received yesterday when I got on the phone with the state.
Excellent. That is very helpful. Do you have to provide proof of employment at the vaccination site? The MI Eligible website does not request any proof.
The site doesn't, but once again, based on the guidelines provided by the state, you do have to show some form of identification. If you have a work ID, please bring that with you. If some of the requirements are for comorbid or underlying conditions, if you can get your doctor to include a note, please bring that with you. If you don't have any ID, if you have a pay stub, please bring that with you. You can get a letter from your employer, and please bring that with you as well too. So there are several ways to prove identification that you are indeed work for a particular agency or organization, and you are eligible to receive the vaccine.
Great. If getting the vaccine does become mandatory and someone is still having difficulties making an appointment because of a shortage or what have you, will that impact their eligibility to continue working?
I don't want to speak for all employers, but I don't think so, right? So if it's mandatory by your employer, but there are no sites available or there's no vaccines available, it's out of the staff's realm, and you cannot, as an employer, you can possibly ask your staff to manufacture the vaccines themselves, right? So if it's not available to your staff, I'm pretty sure it's not available to the rest of the public as well too. So I would hope that no employer is either laying off or punishing their staff due to the fact that the vaccine is not available to the public as well too.
Excellent. Okay, so we have two final questions, and they're both around clarifying the double masking. With children, double masking, how does it affect their breathing patterns for children who already struggle with breathing?
So there's always exceptions, and you'd have to talk to your local primary care provider to determine if your child has an exception that would mean that they can't double mask or those sorts of things. I will say this is not a Department of Health requirement at this point in time. It's just what is considered best practice. So your school district may or may not be following these guidelines. It's just what the CDC says is best practice in decreasing your chance of getting infected. And so anybody 2 and up, I see another question coming in about double masking. The CDC recommends the double masking because it greatly reduces the chance of transmission, especially given these new, more infectious variants that are starting to come around. That's the reason for the change in recommendations. I saw the other question about an N95. That is the most superior, most effective mask. So you're correct. You do not need to double mask if you're wearing an N95.
Great. I think you actually just answered all of our questions that we had. And I see it is now 11:30. So we want to thank the panelists so much for taking the time to expertly answer our questions and spending your mornings with us. We know how busy you are, so we appreciate all that you do for our communities and for sharing what you know with us about the COVID-19 vaccine. So I do want to remind you all to visit our website for more COVID-19 and other after-school resources. We're going to put that in the chat now. We also recommend that you sign up for our listserv to get updates and news related to the field. And don't forget to like us on Facebook and follow us on Twitter. Again, just one more incredible thank you to Dr. Nsiah, Dr. Schultz, and Dr. Holden for taking the time, and to Council Member Mark Levine.
Thank you.
Thank you. Take care, everyone.
Thank you all.
Thank
Bye-bye.
you.